Thank you, Madam Chair. Hi, everyone. I am Congresswoman Grace Meng from New York. I am also chair of the Congressional Asian Pacific American Caucus, and I am deeply concerned, as all of you are, about the way that President Trump and congressional Republicans shut down the government and left town. They are single-handedly responsible for the largest cut to Medicaid in U.S. history and are now taking away tax credits that, as you've heard and as you all know, take away tax credits that help Americans afford health insurance, raising premiums for millions in this country, including over 1.5 million people in the Asian American, Native Hawaiian, and Pacific Islander community. Thank you so much to each of you for the tremendous work that you do, for the life-saving testimony that you are contributing today. For providers like child clinical psychologist Dr. Lee in California, who works primarily with neurodivergent patients with Medicaid, these cuts will significantly limit the care that she can provide. Families may only be able to receive an evaluation, leaving them vulnerable and feeling helpless when they most often need treatment as next steps. My question is for Dr. Ellison. Doctor, as someone who grew up during the civil rights movement, can you talk about how intertwined the movement towards justice was with expanding healthcare in this country? For example, how have the tax credits disproportionately helped communities of color?
Thank you for the question. It has immensely helped people for the first time, as I said before, be able to have insurance and take care of their families. It's helped small businesses who try to employ people and make sure they are healthy and ready to come to work, insure them with self-insurance programs. And I see the parallel because when I was a child, when we were attacked, no one would see us. We had two physicians, Dr. Hamilton, Dr. Harris, who would treat us in the street. And there was no help from anyone, and there was a lot of despair. But thankfully, like I said, the community I came from came in and helped us and made sure that we were well. I remember one time I was hurt more more than I had been previously, and I finally got admitted to a hospital, and I was put in the basement of the hospital, um, right under the plumbing. And a person came to me and told me, be hopeful because God loves you. I was 12, so I said something that maybe I should not have said. I said, I know God loves me, but could you ask him to send someone to move me from under this dripping water? you know, and so there has been parallel all through the rural areas. I work with Congressman Thompson in rural Mississippi because we're neighbors and we're friends. We share the same disparities. And so when we see what's going on now, it's going to roll back a lot of things that people have had. Uh, at a storm site in Selma, I had a person who finally knew how to access health care because before then they won't dial up and we had to help them get care. So now we're going to tell them we're going back. You haven't had health care before. Now you have it. Your family is healthy. You're able to work. But now we have to roll back. And again, we got to go back to the times where you choose between food or blood pressure medicine. And I don't think that's right.
Thank you so much. I yield back.